Tilia Fe is a combination hormone medication used to prevent pregnancy. It contains two hormones, norethindrone and ethinyl estradiol. The inactive tablets taken during the fourth week contain a small amount of iron, ferrous fumarate, and are meant to keep you in the habit of taking one tablet each day. However, they do not contain any hormones and do not have enough iron to treat iron deficiency. In addition to preventing pregnancy, Tilia Fe may also make your periods more regular, decrease blood loss and painful periods, decrease your risk of ovarian cysts, and treat acne. It's important to note that using this medication does not protect against sexually transmitted diseases. When taking Tilia Fe, it's important to follow the dosage instructions provided by your healthcare provider and take it at the same time each day to maximize its effectiveness. Before you start taking Tilia Fe, make sure to read the patient information leaflet that comes with the medication. This leaflet contains important information on when to take your pills and what to do if you miss a dose. If you have any questions, don't hesitate to ask your doctor or pharmacist. Tilia Fe is usually taken once daily, so it's important to pick a time of day that is easy for you to remember, and take your pill at the same time each day. If you are taking the chewable tablet, you may either swallow it whole or chew it thoroughly and swallow. It's crucial to take Tilia Fe exactly as prescribed by your doctor. Do not skip any doses, and take the pills in the correct order. If you experience vomiting or diarrhea, it's important to use a backup birth control method, such as condoms or spermicide. If you experience stomach upset or nausea with the medication, taking Tilia Fe after your evening meal or at bedtime may help. However, you may choose to take this medication at another time of day that is easier for you to remember. Regardless of the dosing schedule you use, it's very important to take this medication at the same time each day, 24 hours apart. Your pill pack contains 21 pills with active medication and 7 reminder pills with iron. Take one active pill once daily for 21 days in a row, and then take one inactive pill once daily for 7 days in a row, unless otherwise directed by your doctor. You should have your period during the fourth week of the pack. After you have taken the last iron tablet in the pack, start a new pack the next day. If you are taking certain medications that can interact with iron, ask your doctor whether you should throw away the reminder pills, iron tablets, each day rather than taking them. If this is the first time you are using this medication and you are not switching from another form of hormonal birth control, follow the instructions in the patient information leaflet or consult your doctor or pharmacist. If you experience nausea, vomiting, headache, bloating, breast tenderness, swelling of the ankles/feet, or weight change while taking Tilia Fe, these are common side effects. You may also experience vaginal bleeding between periods or missed/irregular periods, especially in the first few months of use. Contact your doctor if any of these effects persist or worsen. If you miss 2 periods in a row, or 1 period if the pill has not been used properly, contact your doctor for a pregnancy test. Remember that your doctor has prescribed this medication because they believe the benefits outweigh the risks. Many people using this medication do not experience serious side effects. However, Tilia Fe may raise your blood pressure, so be sure to check it regularly and inform your doctor if the results are high. Contact your doctor immediately if you experience lumps in the breast, mental/mood changes, severe stomach/abdominal pain, unusual changes in vaginal bleeding, dark urine, yellowing eyes/skin, or any of the following serious side effects: chest/jaw/left arm pain, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, trouble speaking, sudden shortness of breath/rapid breathing, unusual headaches, unusual sweating, weakness on one side of the body, or vision problems/changes. In rare cases, Tilia Fe may cause serious, sometimes fatal, problems from blood clots. Seek medical help right away if you experience symptoms such as chest/jaw/left arm pain, confusion, sudden dizziness/fainting, pain/swelling/warmth in the groin/calf, trouble speaking, sudden shortness of breath/rapid breathing, unusual headaches, unusual sweating, weakness on one side of the body, or vision problems/changes. A serious allergic reaction to Tilia Fe is rare, but seek medical help if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects. If you experience any side effects, you can report them to the FDA in the US or Health Canada in Canada. If you smoke cigarettes or use tobacco and are over 35 years old, you should not use Tilia Fe. This is because smoking increases the risk of serious health problems such as stroke, heart attack, blood clots, and high blood pressure when using hormonal birth control. It's important to avoid smoking or using tobacco while taking Tilia Fe. Additionally, it's crucial to keep Tilia Fe out of reach of children, as accidental overdose of iron-containing products can be fatal in children younger than 6 years old. If an overdose does occur, seek medical help immediately or call a poison control center. When taking Tilia Fe, it's important to follow the recommended dosage and take it at the same time every day. It's usually best to take Tilia Fe with food to help prevent stomach upset. Be sure to talk to your healthcare provider about the best time for you to take Tilia Fe based on your individual needs. Before taking Tilia Fe, it's important to discuss with your doctor or pharmacist if you have any allergies to certain medications, especially ethinyl estradiol, norethindrone, or ferrous fumarate. It's also important to disclose your medical history, including any blood clotting disorders, high blood pressure, cancer, diabetes, heart problems, liver or kidney disease, and any recent or upcoming surgeries. If you have diabetes, it's important to monitor your blood sugar levels regularly and report any changes to your doctor. It's also important to inform your doctor if you will be having surgery or if you will be confined to a bed or chair for a long time, as this may affect your risk of developing blood clots. Tilia Fe may also cause dark areas on your face and skin, so it's important to limit your time in the sun and use sunscreen and protective clothing when outdoors. If you wear contact lenses, you may experience vision problems, so it's important to contact your eye doctor if this occurs. It's also important to note that it may take longer to become pregnant after stopping Tilia Fe, and it should not be used during pregnancy. If you become pregnant or think you may be pregnant, it's important to contact your doctor immediately. Additionally, Tilia Fe may decrease breast milk production, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could change how Tilia Fe works or increase the risk of serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Tilia Fe include aromatase inhibitors, fezolinetant, ospemifene, tamoxifen, tizanidine, tranexamic acid, and certain combination products used to treat chronic hepatitis C. Certain drugs may cause hormonal birth control to be less effective, leading to a higher risk of pregnancy. Examples include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. Always inform your doctor when you start any new drug, and discuss if you should use additional reliable birth control. Also, let your doctor know if you experience any new spotting or breakthrough bleeding. It's important to be aware that Tilia Fe may interfere with certain lab tests, potentially causing false results. Make sure lab personnel and all your doctors are aware that you are using this medication. If you suspect an overdose with Tilia Fe and the person is experiencing severe symptoms like passing out or trouble breathing, it's important to call 911 immediately. Otherwise, you can contact your local poison control center for assistance. In the US, you can call 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of overdose may include severe nausea and vomiting, as well as sudden or unusual vaginal bleeding. It's important to seek medical help right away if you suspect an overdose. It's important not to share Tilia Fe with others. While taking this medication, it's essential to have regular complete physical exams, including lab and/or medical tests like blood pressure, breast exam, pelvic exam, and pap smear. Follow your doctor's instructions for examining your breasts and report any lumps right away. Make sure to keep all medical and lab appointments and consult your doctor for more details. Remember, it's crucial to take Tilia Fe as directed for it to be effective. If you miss a dose of Tilia Fe, refer to the product package for advice on what to do. You may need to use a backup form of birth control, such as condoms or spermicide, to prevent pregnancy. If you have any questions, it's important to ask your doctor or pharmacist for guidance. If you frequently forget to take your pills as directed, it's advisable to talk to your doctor about switching to another form of birth control. Make sure to store Tilia Fe at room temperature, away from light and moisture. Keep it out of the bathroom and away from children and pets. Do not flush it down the toilet or pour it into a drain unless instructed to do so. When it's expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.